Welcome to Rick's Corner. I'm your host, Rick Drasin. As always, as usual, often imitated, never duplicated. And I'm here with a good friend of mine, Dr. Marco Giuliano, who I've known probably over 20 years. 25 years. Marco was a bodybuilder and a powerlifter, and when we met years ago, you were competing a little bit, right?
A little bit.
And how long did you compete?
From age 22 to age 41.
Oh, you went that long?
Yeah.
Wow.
My last show was at age 41, the Orange County Championships.
You were in good shape.
And thank you. I placed second in that.
Well, you're always first in my eyes. That's all that really matters. But I want to talk about something. I want to get into your profession, which we're going to do and talk about. But your training back in the day, what years were that?
That was 1983 all the way up to 2001.
Okay.
For the bodybuilding.
Your training then differs than it does today? I mean, were you like an old school bodybuilder?
I was an old school powerlifter and bodybuilder.
Okay. Was powerlifting your first thing that you did?
It was because I trained for football.
Right, okay.
I'm a former footballer.
Okay, so I knew that too. And powerlifting, as far as I'm concerned, gives you the base to build the strength and the core and the body to go ahead and shape to become bodybuilder.
Right. It gives you a tremendous foundation.
It really does.
I think for life.
And I have a question about this too, because you train different for bodybuilding, but we've had a few discrepancies on some things. They say, you know, you do alternate dumbbell curls for this and a barbell for this and this for shaping the muscle. But basically, when you're working the muscle only works one way, up and down, right?
It's true.
The bicep works up and down. Now you can isolate the bicep and maybe squeeze it so you get a little bit more out of it, a little more juice out of it, so to speak.
Hit it from different angles.
Different angles, but still it's going to create its own path, right?
That's correct.
It's going to create its own size and its own shape. So if you're like Albert Beckles, you have this double split.
Double split.
He would have had that anyway.
One of the greatest in the world.
Exactly, but he would have had that anyway because that's the way his body is formed.
Yes.
So if you have a lagging body part, it's like so many viewers out there say, geez, my bicep just won't peek out on me. What do you tell someone like that? Do concentration curls?
I would tell them to use great variety.
Yeah.
Never do the same workout twice in a row, of course.
Okay, of course, yeah.
And yes, they absolutely do concentration curls.
Okay.
You incorporate those at the end.
How was your diet back in those days?
My diet was our traditional paleo diet.
I wanted to hear
meat, fish, chicken, vegetables, starches.
Yeah.
In the form of pasta, rice.
Right.
And yams.
Yeah.
Sweet potatoes.
Yeah.
And then, of course, we just lowered the carbs as we approached the show. Right. The competition.
And what about cardio? Did you do cardio?
We did not do cardio.
Okay.
We didn't even have life station.
I've always said this, and I had some arguments with them. They said, I don't believe that cardio burns body fat. And the guy said, that's not true. I do an hour and I burn all kinds of fat. Well, maybe your body type does. I mean, I'm not saying this that everybody has the same medicine, because you don't give everybody the same medicine when you work on them. Everybody responds differently to what you do. But in those days, as I know for me, dropping carbs reduced my body fat because we did not have cardio.
We did not have it.
No, the only cardio I got was in a wrestling ring, and at that, even after that, I felt like stringy and my muscles were kind of like drawn back.
But as you just said, we had no life cycles. We had none.
No, nothing. Nothing like that. Did you train heavy?
I trained heavy.
All the time?
No, I alternated heavy, light, heavy, light.
Okay.
For each body part, I would have a heavy routine.
Okay.
And when I say light, I mean higher reps, but to failure.
Okay.
Going to failure. Still training with great intensity.
Right. Okay. And how many times a week did you train each body part?
Back then, we trained them twice.
Right. Okay. Me too.
And in today's world, we train in each body part once.
I've tried that.
And
I don't like it.
You don't like it?
No. I mean,
like the old school?
You know, maybe it is good. Maybe you get more rest as you get older because your body changes. And I think I do need more rest now in between my workouts because I am older.
I think the joints do.
I think the joints do too, and we're going to get into that as well because this is an important thing.
But you're only 40 years old. So.
I'm 16 mentally, and sexually I'm about 13 still. At least my mind thinks I am. The old school method of training was the best. There's no question about it.
I think so.
We have a lot of fans out there that are old school bodybuilders. They love the golden era and how we trained back then. We got great results.
We stuck to the basics.
Right.
That was all we needed.
Drugs were not an issue. I mean, if there were pretty basic things that you could get. Actually, they weren't illegal, right. So it worked. Now, then through the years, you got yourself into becoming a chiropractor.
I did,
which was probably one of the best things you could have done because when I was wrestling and I had an injury, the first place I went to was a chiropractor. Someone says, go to the doctor and they can do this and that. But my belief was the doctor's not going to fix me. They're going to operate, or they're going to inject something.
Give you pills.
They're going to give me pills, and they're going to put a Band-Aid on it. But when my back would go out, you know, they'd say, well, you need to do this and that. And I know when my L5 goes out, I come to you. And when it goes out, and you guys have had this, your lower back goes out and you're like S-shaped and you can't shit or do anything, you know, it's like you're really messed up. If you let it go a couple of days, it gets even stiffer, right?
Worse.
Worse.
Because that disc is swollen.
Right.
Due to the vertebra being subluxated.
Right.
The vertebra above it.
Right.
And
then this does this thing.
And whichever side that disc is swollen on, that's the nerve that is pinched.
Okay.
In your case, the L5S1 nerve root on the right.
Right. So when I come to you, and you have a method that you use called
the Gonstead Chiropractic,
which I think is the best.
I do too.
It's seriously the best. I remember one day my back was out, and I was talking to somebody. You were in a group of 4 people, and I said, my
at
back,
the gym,
I can't get adjusted. It doesn't work. And you said, I can do it. And you scared me, Marco, because you're a big, strong guy, and you said, I can do it. And I said, he's going to kill me. He's going to kill me.
I remember that day, Rick, like yesterday.
I will never walk again if I...
That was in 2000.
Was it?
My first year of practice.
Okay.
I was in Sherman Oaks.
Yes.
And you were in an antalgic lean, the S-shape.
Yeah. I was miserable.
In the gym, I said, oh, poor Rick. I got to help this guy. And you were going to, actually, one of my colleagues in the office.
Oh, yeah, that's right, on Ventura Boulevard.
And I knew they were not doing the right thing.
No.
Because I used the Gonstead, all of his equipment, including the Gonstead knee chest tape.
Okay.
Which is for my pregnant ladies.
Right.
And my big muscular guys.
Right. Well, they would...
And I knew that they cannot put you in side posture and adjust that fifth lumbar.
Well, they do the lumbar roll
They
thing.
cannot do it successfully. You're too muscular.
Right. So you put me on that machine like
I put you on the knee chest table.
the knee chest table.
And I pumped that disc.
And you tell me, drop your stomach, and you pump
First
and
I
pump.
pumped, and I said...
Boom. And you could hear this thing pop like 6 blocks away. And I got up, and I said, oh, my God, it's like night and day. I came home, I iced it, I took some ibuprofen for the next day. Next day I was good to go again. Now I've done that where I've waited a week and I was miserable for a week. My son Shane had the same thing for a week. He's walking around like a crab sideways, waiting tables and carrying trays so he can hardly move. So my belief in chiropractors from day one was the way to go. And when I was wrestling, I remember wrestling at a couple of shows outside of town. One of the wrestlers, Seymour Tony, was a chiropractor, and this is a long, long time. I was in my 20s, and he was in the locker room. He would adjust the guys after coming out of the ring.
Right.
If it didn't work proper and your back was out, you just tell your partner, give me a big body slam, like now. And he'd take that slam and he'd hit, and all of a sudden, now give me another one, and then pretty soon it would go in. That worked. So, I mean, it's, if you guys
really did that.
Yeah, we really did that. We really did that.
Amazing.
Just take a good slam and you're back in shape again. The thing is that all of you viewers who call in and watch, and you're out there, you all train hard like we do. You all have joint problems. You have bad shoulders. You have the bad back, the bad knees, elbows. I mean, it's just a product of what you're doing with your workouts. So when I have an injury like this, I go to Marco and he takes care of me. Now, shoulder joints, there's a lot of arthritis that sets in, right?
A massive amount. I think at least my orthopedic surgeon told me, you weightlifters. He's a weightlifter himself.
Yeah.
He said, you weightlifters, you do too much pressing. Your shoulders are worn out by the time you're in your 50s.
Yeah.
And I said, well, what about you, John? You're a weightlifter? He said, I'm lucky. I didn't get hurt.
Some guys don't. They have no injuries. I don't understand. Rock Rill, he comes here, he wrestles. I don't know how old he is. He's not much younger than me. He hasn't got one injury in his joints, and he wrestled for years. He's just a lucky guy. He's like Gumby.
Well, that's rare.
It's very rare. I had said on the show a while back to you guys that even Ken Waller and Rich Piana told me, he says, you don't do any pressing for your shoulders. It kills the joints. Just do laterals.
Exactly.
Yeah, just do laterals. But in your mind, it's hard not to do it.
But if you realize how much pressing we do on the bench, the incline, the decline, we're getting our pressing in anyway. That's
true. And that joint's taking a beating.
It is. So we're overtraining the shoulder, the rotator cuff complex.
Yeah.
Just badly overtraining it. That's what we're doing.
What do you take? Do you think the glucosamine and chondroitin and all that
stuff?
I
love glucosamine with MSM and joint comfort herbs. And I have a line of those supplements in my clinic.
You just gave me some ligament supplements.
And I give you Ligaplex by Standard Process.
I actually feel better.
Yeah, they're great. I take them every day, and I take the Pure Encapsulations brand of glucosamine sulfate with MSM and joint comfort herbs.
How long does that take to get in your system where you start to feel it?
I feel it pretty immediately.
Do you?
Within a week.
Okay. It's been about a week, almost a week.
Everybody's a little different. But
yeah.
I feel it. My body's sensitive. I feel things pretty quickly. Okay. So I feel it within a week.
No, I came to you this past couple of weeks because I have pinched nerves. And now my doctor told me, there's a doctor for you, says I have carpal tunnel. I said, it's impossible. I don't even use the carpool lane to drive. No, I'm kidding. Because this is compressed and my hand goes numb. And I said, if any of you guys have this stuff, please let me know and make some comments. I don't think it's carpal tunnel because when I do this and come around, the blood goes into my hand, it fills up, and it feels fine. Right. So something can here to here is pinching this. It might have a slight bit of it, but I don't think that's the whole thing.
In the Gonstead work, Rick, we look to the neck, the shoulder, the elbow, the wrist in that order.
Okay.
And your pinched nerve is in the neck at the C5 vertebrae.
Right. Okay.
The C5 vertebrae subluxated, pinching the C6 spinal nerve, which radiates into the thumb and index finger.
It makes the thumb hurt here. Now, the other reason why I know that, because this side's bothering me. So it's got to be coming from the center, right? The trap gets sore, it burns, the delt, you feel like bubbles coming up and it starts to burn. That's right. So if I lay on this side, this goes this way and this goes numb, but if I lay on this side, this opens up and this starts to hurt.
Yes.
So it's not carpal tunnel.
No.
That's not,
no. Also, we have arthritis in the shoulders.
Right.
Both you and I.
Right.
So I try to lie supine flat on the back and not turn, since both shoulders hurt.
I do that, but this goes numb on my back. So I lay to my left, I'm okay. So the thing I'm trying to say is if you're working out hard and you're doing a lot of things, these joints start to take a beating. Wrist curls will affect this too. It's just, I just noticed another bump coming up there, whatever that is. As you get older, you start getting all these little things, you know.
Could be a cyst.
Yeah, well, there's one there.
Ganglion, that's a ganglion cyst.
Yeah, I might even remember the gang. But I got a ganglion cyst. All right, so what do you suggest for people who have these shoulders problems? Shoulders, lower back is another big one, isn't it?
Huge. Probably the most common injury among the public.
It is, isn't it?
And it's usually fifth lumbar.
Yes, and this is why you see ads in all the magazines. Lower back sufferers. We got the little thing with little things.
No matter what your occupation is, no matter what you do in life.
Yeah.
I think it's 92 to 94% of people will experience low back pain in their lives. Mm-hmm. It's an amazing statistic.
Is it okay to do deadlifts or no?
I do deadlifts every other week.
But not heavy?
Yes, heavy.
You do go heavy?
Yeah.
Do you think it strengthens that area?
It does.
Because it's never bothered me. But I got out of a chair once to get a pencil on the floor and it went just like that.
But it was already subluxated.
Yeah, it must have been.
It was already sub...
So basically it was an accident looking for a way to happen.
It was. That was just the final straw.
That's the final straw that broke my back.
It wasn't that caused it.
Yeah.
It was already.
Yeah.
And I hear it all the time. Doc, I just bent over to tie my shoe.
Oh yeah, I did that too.
And they think that's what caused it.
I did that. I washed the tire in my car, and these are instances when my back would go out. Yeah. So
then we must trace back. Okay, what did you do the day or two before that?
Yeah.
Oh, I reached in my car and pulled out an
optic. Oh, that'll always do it.
In the trunk.
Do you think, with your practice, and I'm going to continue to do this because you've got to create a habit of this, that you should get an adjustment how often?
That's a great question, Rick. And
of course it is. That's why I asked it,
I always tell my patients, everybody is different. Everybody is unique. Mm-hmm. Everybody has a different set of injuries, different set of life circumstance, history.
Sure.
So everybody is different. There is no one cookie cutter formula, a number of visits per week or per month that I use for,
the individual.
For everybody.
Right.
Some people come 3 times per week, and I gradually whittle that down to once per week for their maintenance, their wellness care.
Right.
Others come once per month.
Depends on the person.
I like them to at least come once per month for maintenance. Others come 3 or 4 times per month. So everybody is different in terms of how much care they need. I myself, I need an adjustment every week, and I get acupuncture every week.
Yeah, you like the acupuncture?
I love it. I love the two together. Mm-hmm. They work synergistically together, and it's fantastic.
I went to an acupuncturist, an Asian man around 80 years old down the street here a couple of years ago, for my shoulder and my knee, and he used the cups, to suck the blood and this and that. And he didn't speak much English. I felt very relaxed when I left, but the next day I was like really sore.
It does make you sore.
Yeah, my knee got real sore from it.
It makes you sore.
Yeah.
You need a few. That's the thing about acupuncture. You need several treatments for it to take effect.
Right. Well, I did. I got one quite a bit. But going to you, I think, helps me a lot. I'm going way back to the days in Bakersfield in the 70s when I'd wrestle. I'd go get an adjustment in town on my back. I drove all the way up there with the L5 out, did a match for 30 minutes and came back out. I was fine during the match, and when I got in the car and I stopped to eat, I was all tweaked again.
Yeah.
you know, work that they were doing in the ring, actually losing me up.
You were really young then, and you still had the fifth lumbar.
Yeah.
And the reason is it's the lowest vertebrae in the spine, and its
Right.
disc, the L5 disc, is the lowest disc in the spine.
Yeah.
So it takes 92% of all the compressive forces that we impose upon it. That's
Right.
what the research shows. And
What about neck? That's a pretty common problem too, isn't it?
very common. And the reason is, for athletes, of course, we know why.
Yeah.
All of the trauma. But for office workers, this is all they're doing.
Right. Well, I've seen so many people have done it. I'm sure you guys have done this a million times. You can't turn your neck this way. You're moving around. My neck went out, and I came to see you one day, and I couldn't turn to I couldn't turn to the left. So I had to do all right turns coming down to see you. This is no joke. I made all right turns to go see him because I couldn't turn to the left. It took me 15 minutes longer to get there, but I figured this out, that 3 rights make a left. So I got there okay. But boy, when that goes, it's miserable.
Miserable.
I do ice and everything you can think of in there.
You usually wake up that way,
Yeah,
don't you?
yeah. Yeah, you do. And it's just really,
I've suffered with it since I was 17.
it's very common.
It's chronic if
Yeah.
you don't get adjusted and take care of it.
Right.
It is a pinched nerve, and it is always in the upper thoracic spine, not in the neck.
Okay.
That is the culprit, and it's called cervical torticollis of the neck, where you can't move.
Oh, yeah.
Sometimes you can't move either way.
You see a lot of older people, older than me, that have that, and when they turn, they're always turning their bodies
Yes.
like this because they got the arthritis.
And we help those seniors.
Yeah.
We adjust them nice and gentle, prone on the high-low table, just with my thumb and hand, just like
Yeah.
I adjust yours
Yeah.
right now.
Yeah.
Since now you're a senior citizen.
Yes, I am. Let's talk
Even though you
about
look 40.
yeah. Let's talk about this device you have because you've used this on me the past 3 visits.
This device is
It's amazing.
invented and designed by Rapid Release Technologies, and they actually did studies on it with NFL football players. A double-blind study to see if they would recover faster. 85% of them did recover faster from this. This has 2 heads, a flat head and a sharper head,
Right.
and
It goes very, very deep, way down in
it
there.
is based on high-speed, extremely high-speed vibration,
Right.
which breaks up and dissipates scar tissue.
Show them because we get a better view from the camera. Right
So
back.
let's do it on your trapezius,
Okay.
on the sternocleidomastoid muscle.
Oh man. You can feel this all the way down your skeletal
What we
structure.
do is we move in a circular motion,
Yeah.
and I palpate to find the spot, tendus right there, the
Right there,
supraspinatus,
Yeah.
and we stay on it for a while.
Does this draw the blood into it?
Well, it definitely helps infuse fresh nutrients into the tissue
Right.
to facilitate healing.
This thing's really good.
So we want to, when we do the rotator cuff, we do all 4 muscles of the rotator cuff, even the subscapularis is way under here.
I got to say something about this. This thing's really strong. So if you guys get one of these or get treated with it, make sure you hide it from a girlfriend. It's going to be way too strong for her.
Way too strong.
This will send her
It's not
into
that-
this will send her into orbit.
But it's not that type of vibration.
No, it's not that tight. No. This I feel way deep, like deep tissue. That is amazing.
For you, I go around to the bicep, get the bicep tendon where it attaches to, to the labrum right here.
Right. That's another issue if you guys train arms and you train bicep and shoulders. Sometimes you can't curl because it hurts your bicep underneath your deltoid where it inserts. You could have a spasm there or a tear or you could have an injury. This really pumps the blood into it and helps heal it up. Oh my God.
So I called the CEO of Rapid Release Technologies and asked him, what other uses does this have besides for athletes?
Yeah.
He said, you can bring this into a corporation and tell the CEO we can reduce their workman's comp expense by treating all of their employees who do nothing but sit at desks at computers
Yeah.
for the most part. And then even for factory workers who are working hard, truck drivers who are delivering loads. This thing's amazing. Every one of my patients loves this.
You know, when you're doing this now, I can feel the tingling coming down to my
Coming
fingers.
through the fingers.
Yeah, from that nerve back there.
Mm-hmm.
So I know that we're hitting something good back there.
It's amazing. So I use it every day.
It is amazing.
I use it because
All
I
right.
bought it because I'm selfish.
All right, so let me ask you a question. First of all, when we close this out, if they want to find you and they want to come visit
Sure.
you, you're in Burbank.
I have 2 locations.
Yeah.
111 North Victory Boulevard,
Which I'll put
Burbank,
up,
California.
which I'll put up, of course.
And 1502. And my Playa del Rey location
Right.
is 8700 Pershing Drive, Suite 1106, Playa del
I
Rey.
know right where that is.
And that phone number is 424 area code 625-9894. My Burbank is 818-558-4030.
And your website.
Website drgchiro.com. There's a link for this on my website.
Okay.
Terry Bradshaw, the great Hall of Fame quarterback for the Pittsburgh Steelers,
Yeah.
gave a great presentation on video
Yeah.
about the rapid release technology.
Oh, this is awesome. Well, you heard it from the doctor. He knows what he's talking about. And if you want to look him up, I totally recommend him. I'll put his website up. I'll put all this information up. And you want to give him a call and come in and see him if you live here locally, of course. And he'll take care of you and make you a new man like he did me.
And women.
And woman if you want. If you want to be a woman, he'll do that too. But the problem with that is it takes surgery. And any woman that wants to become a man will have to go through the surgery called an addictomy. And I don't think you want to do that.
I don't do that. I don't do that.
No. But thank you for watching Rick's Corner. Thank you, Marco, for being here.
Rick,
I really
thanks for
appreciate
having
it.
me again.
Yeah, I've always had my
Great.
trust in you. You fix me up whenever I'm hurt. And you guys stay tuned and look this up if you have any injuries at all. Get them fixed up so that you can have a good training session in 2015 and become the champ that you deserve to be, brother. And thanks for watching Rick's Corner. Stay tuned till next time.
It's rickdrasin.com. He is the equalizer, baby. See you next time.